All right, welcome to the Mental Fitness Podcast. I'm your host, Mike Dunn, co-host Fran Ramsden, and today we have coronavirus round 3. Last time we tried to present both sides of the discussion on reopening the economy versus keeping it closed in order to get people to sort of understand the other side's points, not straw man them, and then, open up the discussion on that. Today, we kind of want to take one specific argument from that and explore it a little bit more. One that I've seen being used more frequently it's a moral argument, it's a utilitarian argument, and it's about the number of deaths involved. And again, this is a concern that we've had all along, is balancing reopening the economy and the ripple effects of keeping it closed and not overwhelming our healthcare system, because there's going to be death on each side of that as a result. So again, the argument that I've been seeing is the number of people who could potentially die from the virus if we reopen things too quickly, as well as the number of people who can die from things such as starvation and supply chains being cut off and shut down. So, Fran, do you want to touch on that a little bit?
Yeah, so Mike will come up with a good, I don't know if you call it example or thought experiment. So he'll get into that in a second, and I think it'll tie everything together. But yeah, so far we talked about Corona. It's been pretty neutral. We just try to present both sides in a way that I think could lead to a productive discussion. Since we've done those, I think a lot has changed in a short amount of time. And, I think, and again, this will be further clarified when we do the thought experiment. We try to talk down that road. But, it seems that we've gone from the outcome of flattening the curve to, finding a cure. And to me, that's pretty interesting because it's essentially moving the goalposts, right? So when we had the economic lockdown and quarantine, the idea is, hey, people are going to get this. This is going to spread. And the goal is we just don't want everybody getting sick at once, and then there's not enough resources, hospital staff, ventilators, etc., to deal with the sick people. So we'll just kind of spread this out, and we'll slowly begin to get back to normal. And I've largely seen that kind of talking point or narrative go away. And instead of saying we just need to flatten the curve and just not get all infected at once, it's kind of now where we see certain, some governors come out and say, no, we're going to lock down for X more months because we need to find a cure, we need to find a vaccine, we're not going anywhere. And so that's definitely kind of changing the outcome from the onset of the lockdown and what the initial goal was. And it does lead down this path of, the counter arguments to the economic part of this, where people are saying, the economic impact is real, sending people a one-time $1,200 check is no good. That's not going to do anything long-term, even really probably short-term. So the best way, to kind of overcome this is to slowly, as best we can, safely get back to normal and get people back to work, and trying to have some resemble of what it was like at the end of 2019. Where again, this is where we're going to lead to this thought experiment, because there are arguments that pop up against that, and they usually revolve around saving lives. And even myself, when I've gone on to Facebook to talk to people about this, the number one argument I definitely get back is, well, don't you want these people to live? And it's not really a practical argument, I don't think. And then there's not really a way for them to tell me a cutoff point. I had somebody tell me 3% of people are going to die, and or 6% or something like that, and I just said, okay, well, oh, so we should shut down to save 6% of people that could be infected and killed. Okay. What if it was only a 2% kill rate instead of 6%? Is that good? And so you just get into this kind of circular argument, I guess, where it's any amount of life, it's impossible to make that cutoff point. So if you're going to go down that rabbit hole of preventing death, that's a very, very tough logic to follow up with. And as you'll see here, you try preventing death with one extreme measure, you may just create death as a side effect of that lockdown, or that side effect of an extreme measure can still lead to death.
Right. And before we get into that, I'll just comment on the moving the goalpost aspect of it, because that's the idea, and that's to us, though, what is most important is balancing, again, not overwhelming the healthcare system with not, with the ripple effects of a closed economy. In the areas where it's not bad, they should open up. In the areas where they may be overwhelmed, local areas should help out, and they should be, a little bit more cautious about reopening. But one of the things we have to consider is, again, the ripple effects. The latest predictions on global starvation is 165 million increased cases. So that, if we're, again, concerned about people's lives, it's not that people wanting to reopen the economy aren't concerned about people not dying. It's that they are, and we have to look at that as well, right? Everyone is concerned with their local area, right? If you're out of a job and you can't feed your family, obviously you're concerned to want to reopen the economy. If you're comfortable right now and you have people who are at health risk, you're going to be more likely to want to stay at home. But we have to look at the other side. We don't want to get into that too much. We don't want to repeat ourselves. That's what we talked about last time. So onto this thought experiment a little bit, because the point I made was sort of a utilitarian argument for reopening the economy, right? And the idea of utilitarian arguments is basically counting the numbers, right? We'll add everything up. Where's the most saved lives? Where's the most deaths? That's the decision you go with. So there's a famous thought experiment. It's the trolley car thought experiment. The idea is that there's a trolley car and it's on the tracks and the brakes stop working. There's 5 workers on the track, and the guy can switch the rail and go to the other track, but there's 1 worker on that track. So the question is, do you flip the switch and change rails? Or do you let fate take 5 people? Most people, well, first I'll let you answer. What would you answer?
Yeah, I'll play along so people can understand where this is going, and I'll try to, because I know the experiment, I'll just try to play. So yeah, I would switch the track to save 5 in order to only kill 1 person, because if it keeps going, it'll kill all 5.
Right, and that is sort of a utilitarian argument. The thought experiment gets expanded though, and it says, now imagine, instead of being able to flip a switch, you're an onlooker, you're sitting in above the track, and there's a person with you who's rather large, and again, it's a thought experiment, so it doesn't have to actually be real, just use your imagination. You're able to push this person over, and they will stop the train on impact. Do you still want to do it?
And then, so this would be the part where it's like,
people start getting
well, I don't, yeah, so I don't necessarily want to do that, because, that means I'm causing the person to die because they didn't have to die, because they're not on the track.
Right. And yeah, that's where people sort of start to feel a little bit more uncomfortable with the argument. It's also where people have a tough time explaining why, though. What makes it different. I think, again, it kind of comes down to purpose and our idea of why it's acceptable in the first case is because the person is a worker. They took that responsibility on themselves. That they have a purpose for being there. It's, includes that risk. There's sort of an inherent risk in that. Also, the responsibility of the driver in that case, right? They also have a purpose to serve. Their role is to keep people safe on the track, and so they have a responsibility to limit the number of deaths. And so that's why I think people feel more inclined to make that decision in the first case. In the second case, again, that's part of the situation is what changes. Now you're an onlooker. You don't have a responsibility to save people. You're expecting the people involved to do that. You have a responsibility not to push people over a ledge. So I think that's kind of where it changes.
This actually has got me thinking about something else here. So, tied in with this. So I don't know all the variations of the thought experiment, but something I had thought of just now, I think would be interesting if it's not already done widely is now imagine you are the overweight person. You can jump on the track yourself and you'll die, but you'll save whoever's down there, whether it's 5 people, 10 people, 20, you know what I mean? Like, you could go on and on and on.
Right.
And I still think it falls back to probably your purpose in a weird, interesting way. But again, there's just multiple variations of it is the point I'm trying to get at, which does create thought and have to work through and try to explain using logic and reason instead of just like giving an answer off gut reaction. So, but that's something else. Again, I don't know if this is a common variant of it, but I think again that would be interesting where it's like, hey, you know, you're overweight. Or, you know, you could even say you're old. You're old. You've lived 80 years. There's young people down there. Like, you know what I mean? Like, there's so many different variations you could do. And that one, you know, again, you could use a version where it's about sacrifice versus not, you know, and somehow maybe people would understand it to be like, in a weird way, selfish versus unselfish or something. I don't know. Like, I don't know. It's interesting.
That is interesting. Yeah, I'm not sure how much that has been explored before. At least I haven't thought about it too much. Yeah, that's a good one. And you're right. There could be a bunch of different variations. You could be the driver. Can you do something, but you'll die? Yeah, you could change the age of the person, change the situation. And I think you're right. That's kind of all those things would end up playing a role in the decision. The last variation I had on it was now you're in a doctor's office. You're the doctor. You have 5 sick patients in the waiting room. They all have a different vital organ that is failing, and then you just happen to have one super healthy guy that you just did a checkup on. He's great. Should you now sacrifice him and use his organs to save the other 5? And this is where again, people, no, absolutely not. But again, when we're talking utilitarian argument, just counting the numbers, that's sort of where, if you're going to stay consistent with the argument, you kind of have to take it to its extremes. Again, I think...
So, you know what? I think this needs emphasized, you know, this idea of why it can be sometimes failed logic to just go with whatever saves the most. I think this is a really, 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 really good thought experiment for this, and I want to make sure we don't just, well, it's not us, but I don't want people to like miss the point. Yeah, I mean, it's not as simple as just saying we don't want people to die, like, so everybody just don't do anything. Like, it's not, that is a very extreme simplistic way of looking at it, and unfortunately, I do think people dig in once they've made their opinion on things for, you know, I guess for a variety of reasons, but most people don't like to be proven wrong or to have to change their mind on things. I don't know when this started. I don't think this was always part of like human history, but definitely, probably, you know, extremely recently. It's I mean, it's like it's very bad to have an opinion and then be shown differently and then be like, yeah, all right, I changed my mind. And I don't know why that affects most people, but it really does, big time. And so this issue here of economy versus people dying of COVID, the people that are for extended lockdowns, or like if you look at the logic of certain governors that are extending the lockdown versus ones that are not, is they are just preventing death, and it's what they say, preventing corona death. We don't want people dying, and it's a multifactorial issue. There's a lot more other things to be considered. You brought up food supply and supply chains, which, I mean, it's part of the economy too, you know, so if people are out of work, there's less people participating in these supply chains and productions and, you know, manufacturing. And then buying, you know, the way the economy is too, it's in a lot of ways circular, where it's not a straight line where somebody just accumulates wealth, keeps it, and then it stays out of the economy. A lot of this stuff is circulated. And so people make money, they spend money, it goes to somebody else. That business owner pays somebody else with that money, and then that person makes money, and then they go out and they shop and spend it. So it kind of flows. And so when you disrupt that flow or that cycle, there are going to be consequences, whether, again, they were anticipated or unanticipated. I don't think anybody said, let's shut down the economy to save people from COVID, and then we know we're going to create deaths with food shortages and food supplies. I think, again, this is something that is becoming revealed as we go, and it should impact someone's ability, and so it should be acceptable that somebody was originally for extreme lockdown, And now, as we continue, we get the COVID data that comes in, mortality rates, etc., infection cases, and then we also get these additional resources about food supply, economics, etc. And somebody should be allowed to change their mind without recourse on them. Like, it should be a good thing to be like, yep, okay, well, we should not, do X, Y, Z anymore. Here's why. So.
Right. Yeah, there's nothing wrong with changing your opinion on it. Yeah, so we kind of went through the thought experiment pretty quick. It's good to do in a group setting so you can get a bunch of different answers and opinions. Like you said, we kind of been through it. But I think, again, yeah, we can talk about the utilitarian argument some more. But I think, again, I also want to point out the reason you do these thought experiments and change the situations is you do want to take an argument to its extreme, because these arguments do evolve, and where they start, the logic creeps. It always gets carried to its extreme, and that's why it's so important to think about these things ahead of time, and try and deal with as many of those unintended consequences as you can. There's always going to be unintended ones, but some of them you can realize and avoid ahead of time if you just pay attention. As far,
yeah.
No, it's just, and then there's a lot of concerns for opening the economy. I think we're at a point where, to tie it into mental fitness, where it comes down to responsibility and risk. Like, it's just odd to me that we're now forcing people to stay inside. Like, no one's being forced to go outside, and if people want to take risk, they should be allowed to, as long as it only impacts them, right? You shouldn't just go. They shouldn't take risks that impact other people. But we're at a point where that's how society's sort of set up, right? Like, how can I limit my own risk and put my risk on someone else? That's sort of the incentive we have in society. But people need to take personal responsibility, take the risk on themselves, and if people want to go out, they should be able to go out, and we should set up a support system for those who don't feel comfortable enough and aren't healthy enough to go out.
Yeah, so if I had to sum it up, it would be placing or bringing back or focusing on self-responsibility and accountability to yourself. I do think we've gotten away from that as a culture and society here in the United States. It's infected our politics. It's infected our family. I think it's infected our business, like economy a little bit. But I do think there is a lack of responsibility, or like the opportunity to take responsibility. So like to your point, okay, any single person in the United States, if they have an internet connection, which most people do, can find the data for COVID-19. Okay, John Hopkins. They have a whole thing right now. It's a world map. I'm looking at it. I have it pulled up. I can see every case has been confirmed. Global deaths in each country, deaths in the United States by state, by county in the states. Like, it's pretty detailed. Now, I do understand that there may be shortcomings with the reporting of the data in terms of, we are now seeing things like the states are recording COVID deaths that actually aren't COVID deaths. I don't think that's disputable anymore, by the way. So I think for a while there it was like, oh, well, I don't know if they're doing that, but I think that's pretty clear that's definitely happening. And like, hospitals are definitely reporting COVID deaths on people. As long as they test positive for the virus and die, they're putting it as COVID death. I think Dr. Birx, actually, which was one of the spokespeople on the team at the White House, said that in one of the press conferences. It was like, we've taken a liberal, I think her quote was something like, we're taking a liberal use of the word cause of death on it. And, so that does inflict some change on the, or, it inflicts some impact on the data that we have to look at. But regardless, you have that, then you have some medical experts saying there's a ton of people that were asymptomatic, whereas they would test positive for the virus but don't have any symptoms. And there's a bunch of people that probably aren't even getting tested that have it, so that what that would do is that would obviously take all these numbers and bring them way down in terms of like mortality. You know what I mean? So like a lot less people would die per population, kind of a thing. So right. So if you start to take these things into account, I'm having a hard time coming up with an argument against personal responsibility to handle COVID-19 moving forward. Meaning, if you're somebody in the United States and you have access to this data, okay, you're looking at everything. You can hear the testimony of people that are quote unquote experts or have more experience than you, and you're looking at everything, and you say, well, I want to be able to go back to work. Like I see it. I see my chances of catching it and dying. I understand. This is giving me a good picture of what I have to work with. I want to go back to work. I would rather go to work and learn and get back to earning a paycheck or back to earning whatever and risk the odds of catching this than not. And in that scenario, that means we would put the responsibility on that person making their individual choice and their decision, so that if they do get COVID, they've got nobody to blame but themselves. They said, okay, yep, I didn't think I was going to get it, or if I did get it, it's okay because I put it into my risk analysis here, or whatever. But that person then is responsible for their own actions that may lead or may not lead to them catching COVID. Whereas we currently have the inverse, which is authority figures saying, no, you're not even allowed to risk it if you wanted to. And so that's kind of that's kind of the meat and potatoes of it for me, is we are not allowing people to have responsibility for themselves and determining if they want to open up their business again, and or if you want to be a patron at a certain business. Those decisions are being made for us.
Right, and for the sake of not talking past the other side's concerns, they would be concerned with people who are at risk getting sick as they,
Right.
go about their day to day. But again, my point is that no one is forcing them to go out, and that what we should
Correct,
do
right?
is find a way to help them, people who are at risk and can't go out, right? Like, let's get them their groceries,
Yeah.
let's get them their essentials, let's get them what they need. But why? It's just odd that we're forcing people. And again, to tie everything in, is that we need to take things to their logical extremes. Where do you cut things off in terms of risk? Like you said, what's the number that is acceptable? How do we balance, like, cars are an economic, efficient tool that, we all use every single day. It's a massive convenience. It makes our lives a million times better. Probably saves lives. But what are the stats on deaths from car accidents, right? Like, what point do we cut things off? I understand that this is different and this is something new, and this could also have disastrous effects, and if it spreads, that could shut down the economy as well. If our healthcare system gets shut down and our economy also gets shut down, we're in a much worse situation. I realize that. And we should also, again, pocket that,
keep
right?
talking.
Like, if New York is getting hammered right now, like, then New York shouldn't open up. But if Nebraska is fine, let them go.
Right. Well, so
also, I
want
to point out. I just want to point out real fast too, in terms of the stats, because they are all different, and it depends on what they're measuring. And I have a feeling they're all inaccurate because, again, it depends on, like you said, what we're testing, who we're testing, how accurate those tests are, a number of factors. Here in Allegheny County, locally, we're very lucky to have some, like, the best healthcare in the world, and so our numbers are fantastic. And I don't think that locally that numbers are being fudged, but we have seen it generally nationwide, worldwide.
Yeah, I mean, that's like an extremely difficult part of it is, yeah, I mean, you have to be able to try to work with what you have, right? And so, does the John Hopkins website serve as a good resource? I mean, probably. I mean, to get at least, like, for instance, it says right now, total confirmed cases in the entire world, 4.4 million people have tested positive. Total number of deaths in the entire planet from COVID, 301,000. So, I have here some stats that compare. So, if I had selected only the United States, I could do this on the website, okay? It says the United States has a total confirmed case count of 1.4 million COVID-19 tests, or positive tests, 1.4 million. The total U.S. deaths to date, as of May 14th, is 85,500, about. So you have 85,500, and I understand that this has only been for a couple months, right? But this is where again you can tie in responsibility. Is if you look at total tobacco deaths in the United States, okay, I have here just from the CDC's website itself. Okay, it says cigarette smoking causes 1 of every 5 deaths in the United States every year, which is bananas, by the way, and more than 480,000 deaths annually from smoking tobacco. So, 480,000 deaths a year from smoking. We have 85,000 deaths from COVID. And again, I understand COVID hasn't been an entire year yet, and it's a little bit different because it's infectious and it's not someone just smoking a cigarette to themselves. But there's a whole secondhand smoke, et cetera, et cetera. But again, it comes down, and I thought you tied it in good about what about the vulnerable, and it's like, I bet you there's still a large percentage of the vulnerable that want their own power to make the decision. Like I have a hard time believing that there would be an overwhelming amount of at-risk population. So this would primarily be elderly and those that have a lot of health issues. That population has been the most affected by COVID-19 in terms of the mortality stuff. So, but I don't know. Maybe I'm wrong, but I tend to think even those populations would want the power to make the decision to either stay home or not. We all have grumpy grandparents. Always talking about, oh, I'm going to do this, I'm going to do this, do that. So who knows? But even for them, if they wanted to take responsibility for themselves, they could. There's plenty of things that they can do in terms of stay at home. And then here's the other way I thought about it too, is imagine, Mike, that you're the owner of a grocery store in a local community, okay? And if the government had said, we're going to reopen, okay, at-risk people, we'll put the power back into the individuals' hands to make their own decisions, give them the responsibility to do what's best for their own health. And you're a grocery owner and you've got people that are at risk that aren't willing to come to your grocery store. Do you think it's in your interest to find a way to deliver groceries to that population of people or that subsector of people that do not want to make the trip to your grocery store even though other people are?
Absolutely. Yeah, no.
So
right,
it's not like they're just going to sit at home. You know what I mean? It's not like they're just not going to have help from anybody in the world. Because I think everybody wants that. Everybody wants to keep the risk low for those that it mostly affects, and it is older people and people that have health conditions. So, that kind of ties into that argument before, though, where it's like, how do you cut it off? You can't. I don't think it's practical to lump healthy people with older people or healthy people with people that aren't healthy. Just seems like trying to prescribe one thing for everybody, and it's a pretty extreme measure. I mean, I've been alive for 30 years. I don't remember ever there being a national lockdown like this. So, it's pretty extreme. You do got to take these things to the extreme to work out the logic. And I think, though, with the data that we currently have, as imperfect as it is, I think it's enough that I think people can, this isn't the Black Plague. This is not killing half the world's population or whatever. It's not. So, with the risk being where it is, I think it's a low risk enough of an illness that there's no massive scare from letting people be in charge of their own lives. That's kind of the point I'm getting at. And I bet you if you ask a lot of business owners, and I'm not talking bazillionaires, I'm talking people that run mom and pop, they're local, they've been doing it for 40 years, maybe they have a plumbing business, they're pretty much, I bet you they would say, yeah, I get it that we could get corona if we go out into the public, but I need to make income. I've been doing this for 40 years. I have no other way to make money. And I got people calling me. Customers want me to come fix the sink and fix the toilet, this, that, the other. So again, I think if we give power to the people to make their own decisions, I think that's a lot better than just coming up with a policy and having one individual, a governor or something, make up the rules for all of us. I think it's much better to take the responsibility, and put it into individuals' hands. For themselves.
Yes, yeah. And I think that ties everything in very nicely because, again, just to make the utilitarian argument, the numbers I saw most recently, I don't know, maybe you can pull up better ones, but I saw predicted it could be as bad as, right? This is, more worst case scenario. 40 million deaths from COVID this year alone worldwide. But again, compared to the 165 starvation... Yeah, that's global. 165 starvation, that's 1/4. But I don't like utilitarian arguments, and I agree. What's most important is letting people make the decisions on their own. We need to stop treating people like they don't know what's best for them. We don't want to sound like we know what's best, right? I don't know
Right.
what the best answer is for everyone, and I think that's a central part of what we're saying is we don't like centralized power. We don't want other people making decisions for other people. Let individuals make decisions for themselves because they know best. And
Yeah, so even if you were a healthy person who was younger and you looked at this data and you did not want to go out in the public, like you wanted to keep quarantining, like you're free to do that if you have the responsibility for yourself. So it's not a thing where it's like you have to be forced back out there. You see what I'm saying? Now, there might be consequences economically, but then we have that now. So
right, and that's
and again,
we could set up something even because again, like we're already, you know, paying stimuluses and stuff. Like we could set something up for that, and what I would prefer is to get back to local charities and helping out people
Right.
locally, but because then you can see and you know where it's going. Hey, this person is a genuinely good person, and they are concerned about their health. I'll help them out for a little while. Or this person's taking advantage, and you can make that decision at the local community if you know them.
So I have a little experiment, a little thought experiment of my own here. So I really want to drive home this idea of the utilitarian argument here because I don't want people getting confused by it, right? Like I want to be as crystal clear as we can about what that means and how that really applies, okay? So let's play a little game and pretend that you've made that argument for COVID, meaning you don't want us to rush, quote unquote, you don't want to rush to unlock the economy because you don't want people to die from COVID, right? Like you don't want people to die unnecessarily. So if we all together just band up and we just all stay quarantined, that should slow and stop the infection rate and it'll kill less people, okay? Let's say you're making that argument and everything else doesn't, you haven't been persuaded with other stuff about starvation and things like that, right? Well, if we go back to that stat I said earlier, right, about smoking, okay? So again, Mike, you've made the argument, utilitarian argument about COVID-19 for quarantine. And I come to you and I said, okay, well, did you know there's 480,000 annual deaths for smoking tobacco? Are you for banning tobacco? What would that person, like what would they have to do logically done to try to answer that question based off of their argument that they just made for COVID?
Not smoke tobacco.
Okay, right. Like, so you're saying that they would be forced into that answer logically.
Unless they had a bias.
Okay. So what if, how would you, okay, because again, these are like topics that me and you talk about all the time, and I'm trying to like make it super easy and dumb so that people that don't talk philosophy and don't understand logic and don't people in normal life, people go to work, they take care of their kids, they play some video games, or they watch TV and they go to bed, right? So they definitely don't research like this. So, okay. So if you're somebody, again, if I ask that question about tobacco, okay, and let's say you said, well, no, I would not be for tobacco. Okay. Yeah. Does that create a double standard? Does that create kind of like an illogical thought process? Like, how would you try to like describe to a lay person what that would mean to them, their mindset, to the way they think about things, or even like the way they formulate opinions, if in one instance they are using a utilitarian argument for COVID, but then when we try to present a utilitarian argument for tobacco, they reject that? How would you try to like parse those two things? Could somebody parse those two things, or does it seem inconsistent?
It would be inconsistent at that point, I think. But yeah, the idea is there. So there's two separate ideas. The utilitarian argument is pretty much just counting lives. Whatever saves the most lives is how you make a decision. This does end up being used, and it's not, it's a practical method for things. If you have to make policy, right? It happens in government all the time. They have to make tough decisions, and again, that's why we're saying there's no easy decisions here between balancing the economy and the healthcare system, because there are going to be people that lose lives, and that's one of the ways that they make these decisions. We feel that there's other concerns that should be taken into consideration as well concerning individual liberties. But in terms of taking the argument to its extreme, I guess there's examples both ways. I mean, it happens slowly and it happens over time, but a positive example of it happening could even be what we consider our individual rights, right? Like people didn't start with that, but a seed planted and the idea progressed to its, and it's continuing to progress to logical extremes. What does it mean? And people keep asking that question. What does it mean to have individual rights? What should those be? And they expand. On the other side of things, that's sort of how they get shut down, right? Whenever we see people being oppressed of their rights, it comes from the same idea. It starts off small, and you take that to its extreme. Okay, now we need to shut things down for this reason. Well, still security. Well, we need to be more secure. We need this, we need that. So it's just a way of thinking about things ahead of time to try and avoid some of these future unintended consequences. Because again, a lot of these decisions are made with good intentions in the short term. We just don't realize the long-term effect.
So if you would say our position right now, and again, I don't want to speak for you, but I think we're on the same page about, we would advocate some version of putting self-responsibility back into this ecosystem, giving people, obviously with restrictions. We're not saying have at it, let her rip, let them, let the economy rip, baby, let it rip.
Right.
We're not, what I mean, with restrictions. If we're advocating for some version thereof of self-responsibility for people to make their own decisions, how would you best try to handle somebody that just is compatible, like disagrees with that concept, and maybe need convincing, or if you were to try to persuade them into seeing the other side of it, whereas they tell you, look, that's all well and good, I just don't trust other people. You see them, they're going to be stupid. They're going to go to the beach, they're going to spread the infection everywhere, they're going to go to they're going to go visit grandma, and they're going to give her it, and then they're going to die. We're going to have all the old people die, and it's just because people would not stay in lockdown. I don't trust people. I hear what you say about responsibility. It sounds great on paper, but I think people are going to do stupid things. They're not going to do it smartly. And it's just going to spread the disease worse, and people are going to have more death. How would you best try to handle that opinion? Because I think it's probably the inverse to ours. Like, I think that would probably be the most common reaction if somebody disagrees with what we're saying today, would be they still are just fearful of how people would behave and or how we could potentially impact somebody else, right? So like, yeah, right, you should have freedom until it impacts somebody else. But what they would say is, well, if you have corona and you're asymptomatic, meaning you don't have any symptoms, so you're just going out living your life, you're going crazy bananas everywhere, you're going to give it to somebody with a poor immune system, or you're going to give it to somebody that's old and they're going to die and it's your fault.
Yeah, I mean, we may actually agree more than we realize. People are not trustworthy and make stupid decisions all the time. That's not a new thing. Again, we have to still go about our lives, and again, it's a new factor that we have to consider. But this is, again, what we're telling people is when they go out to be responsible. First off, they should be responsible. To your point, they're not going to listen. We know that. Not everyone, at least. Again, no one's forcing this person, you to go out if you don't want to, right? And as we said, I agree with your position. And yeah, like I just want to emphasize again, we should have things in place for people who are at risk and can't go out as we reopen. And if that has to be part of the reopening deal, I think that makes sense. But I mean, you have to, again, taking things to their extreme, at what point do you do this? Is the person in this question concerned for their own health or concerned for a relative's health?
That's actually interesting. So I have not seen most people be fearful about themselves.
Right.
So when people are advocating the continued lockdown, or they're supportive of the orders made by their governor, or or just taking that traditional stance of being against economic release or getting back to things, I do not see them say, I'm scared, I'm going to get it. Don't give it. I do not want it. That's not what I've seen. I've seen them use the argument more so, you're going to give it to old people. You're going to give it to sick people. If people go out, other people will get sick. So it's not themselves.
That's interesting. I've sort of noticed that too. And like I've been saying, it's good intent. It's good intentions, but our point, I think, is that we need to let people make decisions for themselves. If this person's fearful, because it's a different discussion, but if everyone's just concerned about another person and no one's actually concerned, like you see the problem in that.
So I think that's actually it, though. Like, I think we might have stumbled upon something here. It's like, the people that are making the argument to keep the economy shut down, they are trying to make decisions for everybody else. Right.
And again,
fundamentally,
yes.
Yeah.
I was just going to say, and I want to clarify again that we don't want to seem as we're making these decisions or know these decisions and what's best. Our idea is that we don't, and the person who knows best is the individual.
Definitely not. Right. Yeah. Yep. And again, working through that logical process of how we got there, try to give some insight on my thinking in terms of like combining data with critical thinking and trying to work through what makes most sense. And I think broadly speaking, what makes most sense is there's going to be different answers for every single person. So let them make the damn decision. So like me, I'm 29, I'm healthy. I don't even get like seasonal colds. Like I don't have anything. I'm probably somebody that would probably be likely to be asymptomatic if I were to catch corona infection, or or be sick for a week or something. Like I wouldn't anticipate me going to the hospital. Could be wrong. Could die. I don't know. But I'm saying, it's just, if you look at the stats and take my current health, I know me best. I know me better than any governor or any person on the internet knows me. I can make the decision what I think is best. Again, because it is perception. What I think is best for me. Whereas if you're an individual who is advocating for these group lockdowns, essentially, from a logical standpoint, a thinking process, you are telling people, I know what we should do. I know what you should do. I know what we should do as a group. This is what we should do. And there's no room for individuality there. There's no room. And again, essentially, you have a few people telling everybody else what to do. And I don't know if that makes a lot of sense in a lot of cases, especially not for COVID-19.
Yeah, I think we have to watch about, someone might know better, but forcing that on a person is a line we have to keep an eye on. I think, again, be an opportunity to tease. I promise we'll do this next episode. I think this ties into the independence versus reduced suffering. So I think this was a pretty good way to wrap things up. Did you have anything else to close on?
No, just give my little closing. Everybody should go to Google and put in John Hopkins COVID data. And the first link that comes up to their website is a world map thing. And you can click on all these different things, states, like I said, counties inside of states, other countries. It's got a trending thing. There's a lot of pretty cool data on here. Again, it's as accurate as we can get at this point, because I know there's a lot of discrepancies there with both the reporting of positive testing and deaths and things like that. But again, I think it serves as a benchmark that we have. People should go there, and they should just kind of like get into it for a little bit. Like, I think it's good if people have some information to make decisions, because if you're somebody that has not looked at this data, right? If you've not looked at it, at least glanced at it, have an idea of what it is, and you're out there making opinions, like, my question is, what are the opinions based off of? It's not data. So, and even if it's like, well, I read an article and they use data, like, okay, but your argument's not off data that you saw. Your argument's based off of an article. Somebody else. So you're saying what somebody else said. It's regurgitation. So we want to kind of avoid that, is what I would like to encourage. Just get people to look, just go to the website. It's free. Go to the website, look at it, make your own opinions. You can look up articles afterwards. Like, there's all this stuff around. And again, I think it's good if we get more people thinking for themselves, we get more people looking at the raw stuff and coming up with the opinions, because that's kind of what the media has done. I know we didn't talk about it today, and I think we'll talk about it in the future here, but really, when you look at the news media, they're in the business of telling you what to think. They're not really in the business anymore of presenting down the middle, here's what we have, you guys think about it for yourselves. It's not that. It's much more, and it doesn't matter what channel you watch, left, right, middle, they tell you what to think. That's their job. So that's
Yeah.
kind of what I want to avoid and get out of for most people. I don't think that's healthy for our society. I don't think it's healthy for any individuals. And yes, even if that means somebody's quote unquote stupid, if they're making their own decisions, I still think that that's better than them being told what to do. So, that's kind of it. As raw dog as I can give it in terms of what we kind of are advocating, like what I'm advocating for in this episode. And you're right. I'm not even telling people what to do. Like if somebody wants to stay at home for the next 9 years from COVID, fine. They want to do 3 months, fine. They want to go out tomorrow. I'm mostly fine with a lot of things. Just got to be, I guess there's common sense things that we can probably get some common ground on between both sides. And I think that should be the path forward.
Yeah, I agree. Yeah, common sense stuff. Obviously, we're saying with some restrictions, and yeah, that's
there she
a
blows.
pretty good way of finishing it. There she blows.
Rams and Mental Fitness on Facebook and Instagram, and Twitter is Rams and MF. Again, shoot us a message, shoot us a DM, give us your thoughts on the episode. The audio version will be on all podcasting platforms such as Stitcher, Spotify, etc. And then the video podcasts are on YouTube and Facebook. So throw that in there.
All right, thanks, guys.
See you.